Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovelo, and I'm here today with one spectacular Dr. J. Calvert. How are you?
I am doing really well.
Good.
I am happy that as of right now, I don't need a tummy tuck. But notice the qualification. As of right now,
you do not need a tummy tuck.
I'm not saying that's not coming.
Never say never. Never say never. But today's topic is tummy tucks.
Tummy Tuck 101.
Tummy Tuck 101, bringing it back to the basics. We're trying really hard to just do little small short podcasts with this.
It's not working.
But we're going to do this one. We're going to keep it short and sweet. What you need to know about tummy tucks, because we do a lot of them and a lot of people really need and want tummy tucks. So from the basics, what is a tummy tuck? The fancy medical term for a tummy tuck is abdominoplasty. And basically it's 3 or 4 maneuvers. It's a procedure done to remove excess skin of the abdominal wall. It usually includes tightening of your stomach muscles, so the rectus muscles, which I'll talk about in a second.
Damn near killed us.
What? So obscure reference
I had to do it.
Unaware of.
It's okay. Don't worry.
The rectus muscles are brought back together. And then plus minus some liposuction. Most people usually need a little bit of liposuction, at least of the flanks, but sometimes of the abdomen as well. And then the belly button is repositioned in space. So let's break that down a little bit. So who needs a tummy tuck?
So making the diagnosis of who's getting this, because by the way, there's lots of ways to do this, and there's lots of variations of abdominoplasties depending on what your diagnosis is. And that's always, I mean, it sounds crazy to say this, but rule number 1 in medicine is make a diagnosis.
Make a diagnosis. But this one's pretty straightforward. I mean, there are some things where it's like, does she need this? Does she need that? But
if you got the Dunlap.
You kind of know when someone needs a tummy tuck.
Yeah, the Dunlap.
The Dunlap over.
Your belly Dunlap over your belt. You need a tummy tuck, right?
I know a few dirtier words to describe that, but the Dunlap.
So when it's hanging, we want to take it off. That's not good.
But the classic person who needs a tummy tuck is a mommy, someone who's had 1, 2, 3, 4 kids, and their skin has been stretched out over time. Doesn't have the same elasticity to it.
Lacticity. That's what Dave says. My trainer calls it lacticity. He goes, lacticity is no good in Europe.
No. Laxity. So they have some stretched out skin that may or may not Dunlap over some areas.
There you go.
They have, let's talk about this rectus muscle. So the abdominal muscles, your 6-pack muscles called your rectus abdominis muscles.
They're splayed.
They're separated. They're supposed to be tight right next to each other all the way down the midline. If you have, say, a hernia is when those muscles separate completely, through and through, and your abdominal contents can actually come through the muscles, and then they rest under your skin.
There's a hole in the abdominal wall.
That is a hernia. A rectus diastasis, the muscle bellies themselves have separated, but the connective tissue that lies on top of them is still intact. That's the fascia. And so the intestinal contents don't come out, they don't herniate, but the rectus muscles are still very much separated.
It's that lower pooch. That's what we're talking about.
Or the upper. I have a decent amount of weight loss patients. Anybody that's gained a lot of weight, lost a lot of weight over time, the upper abdominal muscles. If you've had a big baby, the upper abdominal muscles will separate.
True. But the real reason for that, though, is that in the lower abdomen, there's less abdominal wall layers below this one line. As you go low towards the abdomen, there's less layers of the abdominal wall, 3 in the upper, 2 in the lower, and basically the reason that is so that the babies can grow, and there's some room for them to stretch out the abdomen. However, they also stretch out the rectus, the linea alba, basically that line between
down the middle,
between the 6-pack muscles. It gets stretched out. It can be as wide as I've seen them 12, 15 centimeters wide.
They can be really wide. And in the average postpartum mom, there may be a little bit of separation, which they may or may not like, but it's not debilitating. But there are some women, especially if you've had twin gestations, or if you are a petite woman and had a large baby, there are some people that their abdominal muscles are just destroyed, and you can see it. They might be really small women, they might be fit, they might have very little fat, but